Pleural effusions. So in this section, we are going to talk about pleural effusions and the main two types of effusions. Those are the transudative effusion and the exudative effusion. The transudative effusion first, and this is most commonly caused by heart failure with reduced ejection fraction, hypoalbuminemia, cirrhosis, and the nephrotic syndrome. So actually, how do we define it as a transudate? Well, Light's criteria is what we normally use. So with a transudative effusion, the effusion to serum protein ratio is less than or equal to 0.5. The LDH in the effusion is less than or equal to 200 units per liter, and the effusion to serum LDH ratio is less than or equal to 0.6. Moving on to exudative effusions. In these, the criteria is different. So in the exudative effusion, the effusion to serum protein ratio is greater than 0.5, or the LDH in the effusion is greater than 200 units per liter, or greater than 0.6, the ratio of the effusion to the serum LDH. So bacterial pneumonia is actually the most common cause of an exudative effusion, and if there is greater than 10 millimeters of fluid from the lung surface to the chest wall, the patient may need a thoracentesis to determine if it's an empyema or a complicated parapneumonic effusion. So a complicated effusion is indicated if any of the following are found: either loculations on imaging, a pleural fluid pH less than 7.2, a pleural fluid glucose less than 60 mg per deciliter, or a positive gram stain or culture. And a complicated effusion generally requires chest tube drainage. An empyema is diagnosed when frank pus is found in the pleural space. Malignancy is the second most common cause of an exudative effusion, and think lung cancer, breast cancer, or lymphoma as being the common causes of malignant effusions. Also, we can see a exudative effusion with mesothelioma, pulmonary embolus, viral infections, and tuberculosis. Now, some key effusion findings: if you've got white blood cells greater than 1,000 per microliter, think exudate. If the white blood cells are greater than 100,000 per microliter, think empyema. Now, a couple of clues based on the glucose level in the effusion. If the glucose is about 80 mg per deciliter, think TB. If it's around 60 mg per deciliter, think cancer or empyema. And if it's really low, the glucose less than 30 mg per deciliter, think rheumatoid arthritis or empyema. Chylous effusions are white-colored exudative effusions with a triglyceride level greater than 110 mg per deciliter due to fat globules, i.e. chylomicrons. The chylous effusions are due to leakage of thoracic duct lymph, so think trauma and cancer, especially lymphoma.